That works again over because of the function of what? The function of the IT band. We talked about that yesterday. That's why people with IT band problems, that's why they start to have problems. And they can be from cycling if their seat's not the right height, or it can be from running and things like that, because this IT band goes back and forth over here, right? And so, when we take the patient like this, if they have the anterior cruciate ligaments gone, so that means I can push this right out of place, right? I can push that tibia right out of place because nothing's holding it in the non-weight bearing position. Then what I'm going to do is I'm going to add some internal tibial rotation. I'm going to just push up through here, and that'll subluxate it, okay? I'm sorry, I want to do this straight. That'll subluxate it, it'll push it out. But when I do this, the IT band goes behind the femoral condyle on this side, and when it does, it just pulls the tibia right back into place. Okay, so in this position, I'm adding some stress. Nothing's holding it back. The anterior cruciate ligament's gone. But when I go like this, the IT band shifts its position around the condyle and pulls the tibia back into the normal position. Lateral pivot shift. Okay, so everybody got that? Everybody understands that? Okay. These next couple tests are for IT band. So what we're going to do is we're going to bring the patient's leg up like this, nodeless compression. We're going to put pressure again right over that femoral condyle. And I'm going to just straighten the patient's leg with pressure. And as I do that about here, this straightening is going to cause the patient a lot of discomfort, right? And the next one, we're going to do Renne's or Renne's test. I'm going to come here beside my patient. I'm going to put my thumb in the same position here. Now the first one was passive. This one's active. And remember I told you, pretend you have a stool. Step up here on the stool platform. There you go. And so this is the way it's normally done. It's like this, and then you have the patient step up on that. If you don't have that, then you're just going to hold pressure here and have the patient move away. You'll hit the table. Have the patient squat. There you go, and come back up. And when they're coming back up, that should cause them discomfort. Okay, so everybody got that? That's Renne's test, or Renne's. Slocum, we talked about that just a minute ago. This is for, again, anterior cruciate ligament. But it's for anterior medial and anterior lateral rotational instability, right? So anterior lateral rotational instability is this way, and so I'm going to pull this way. Now, if this lets go, not only is it the anterior cruciate ligament, but it's the posterior cruciate ligament. You got your IT band. You can put up damage there. Your lateral collateral ligament. Somebody really jacked their knee up. You go like this, and everything's going to let loose, right? Now, this one again is just anterior cruciate ligament, but it also gets the medial collateral ligament, and I think the capsule gets involved. There's a bunch of things, but I don't really want you to say all the different ligaments. I just want you to remember, if it's this way and it comes out, it's anterior lateral rotational instability. This is anterior medial rotational instability. Okay, so everybody got that? Okay, this is for the patella. The patella usually, when it dislocates, which way does it go? Does anybody know? It usually goes lateral, from what I understand. We had a student here, by the way, with one of these a little while ago. I'm trying to think of her name. A little Hispanic girl. No.
Carolina?
Who?
Carolina.
Talia, yes.
Talia.
Talia. Do you remember when her kneecap went out? Does anybody remember? No? Okay. But anyway, she had some trouble with that. And I remember she was still in trouble. We actually adjusted her tibia or femur, I can't remember, and that really helped her a whole lot. But so anyway, you just watch the patient's face and you push it in that direction. And if the patient feels like that's going to dislocate, they're going to not be happy. They'll give you that look, or they'll move their knee or something. So you can test it in all the directions. You can move it medially, up. You can move it laterally, whatever. But generally, it goes laterally when people go this way. That stays over there. And by the way,